What's up?
Can you see it? Can you do it, Dwight?
Yeah. I'm still trying to screen share. Host disabled.
Hold on one moment here.
So
You're
as
now a
he's
host.
as he's giving me the opportunity to do that. Remember, even though yes, the elections and all, and you say, well, that's all behind us. No, community is not behind us, and divided communities lead to very, very destructive patterns in children. And so, what we want to be able to see is healthy communities, healthy children, and being able to move forward to just help little guys and little gals be who they were designed to be. Okay. I have a screen, but I'm not seeing it responsive. Everybody, please stand by. Do not adjust your sets. Yep. Okay. All right. So, Gabi, I'm going to go back to this. I'm going to have to close it out. Everybody, please stand by. But when we think about children, as I'm bringing that slide deck back up, little guys and little gals who have parents who are still combative, and what that does to children, because they grow up afraid and they grow up believing that those people who are different, well, those people are bad. You have to teach that in children, but you can also unteach it. All right. Going back to the original screen share. All right. Mr. Berman, are you seeing the title slide?
Yes, I am.
All right. Let's see if it comes into presenter mode. All right, folks. Gabi, can you see what we need?
I can. It was great.
Good. All right. So apologize, folks, for the momentary delay, but maybe it just gives me a minute to say children can learn to accept other people who are different, right? They can learn diversity, they can learn connection, they can learn empathy, and they learn it by watching the adults. And even though an election is over, the divided state of our country goes on, and it's about fear. And that's what we're going to focus on today. Vaccination anxiety is to be able to see how fear can block somebody from a healthcare decision. As of this morning, you've got almost 500,000 Americans dead because of COVID. The Journal of the American Medical Association says adults over the age of 45 are more likely to die from COVID than car crashes, respiratory diseases, drug overdoses, and suicide. COVID now the number three cause of death in the United States, and it's only been here 10 months. It is reaching an epidemic level in the US and obviously all around the world. 71% of Americans say the worst is yet to come. So you would think, well, everybody, if the worst is yet to come with coronavirus, huge spike in cases, everybody knows folks who have lost a loved one. Maybe you have, I have, and I'm sorry, because the worst is not behind us, according to the data, according to the research. And what we're going to focus on today is about belief. You may be thinking, Dwight, I thought we were going to talk about issues related to vaccine. Well, we are, but we're going to talk about belief, because your belief is what changes your behavior. Facts reinforce behavior. And you say, well, facts about what? Think about some of the examples. Up until a few decades ago, smoking was seen as just a normal, it's your choice. It's a free country. You can smoke what you want. And now more people than ever believe tobacco is harmful. There was a time that seatbelts, you had to really educate people about seatbelts, save lives. There was a time you had to educate people about processed foods and trans fat. There was a time you had to educate people about face masks and how preventing a viral infection from getting into your lungs. And now we're at a stage to be able to talk about vaccines. What do you believe? Why are people afraid of this? Some say because it was developed in less than a year. Some say it's because physicians were pressured to speed up a vaccine because of political agendas. Others think the government is using them like guinea pigs, and the vaccine is just part of that. Are there long-term effects? Are there side effects? Will the vaccine mean no more face masks and we get to go back to normal? Should you get the vaccine first or other people in your family? Should your kids get it before you? And if you have the vaccine, you can still catch the coronavirus, so why bother? Is there any truth to conspiracy theories? Does an organization have the right to enforce teachers, employees like staff members? Can a school force students to receive a vaccine they don't feel safe about? There's a lot of fears out there. And you think, well, why is this happening? Part of it's because of COVID brain. Exhaustion, depletion, being overwhelmed, bone tired. It feels like your family's in crisis, your friends are in crisis, your community's in crisis, the whole country's in crisis. Why? Now we're over 10 months of forced isolation. And isolation desperation can set in. Unemployment numbers in Orlando are still almost double the rest of the country. For some people, being able to say the recession, COVID recession started in April 2020, it's projected to go until at least January of 2022. When you think about why are people so overwhelmed? Because they're working from home, they're trying to help their scared children in situations where they're going back and forth, and maybe before they had a really balanced custody arrangement, and now because somebody's lost a job or housing has changed or they lost a home, the parents are scared, the kids are scared, and they're trying to do school with a screen. Maybe it's because of the building debt and people are feeling overwhelmed. How am I going to pay for all this? Why do we get exhausted? Domestic violence rates are higher than they've been in decades. And when we think about people who are feeling so overwhelmed, suicide rates have spiked. The level of divorce highest that it's been also since the 1980s. Why? Because if you're isolated and you're at home and you're together and your marriage relationship was weak, it's not getting better by spending all that time together. For some, it's the loss of community. They feel so isolated. They can't get together with their friends, their neighbors, people in their house of worship. They can't go to the events at the kids' school anymore, and some relapse with substances. Some are so overwhelmed, they're going back to addictions. One of the reasons I'm so thankful to be able to share with you, and the reason that Central Florida Behavioral has created this learning series since the very beginning of the COVID epidemic, is because some people who have been sober for years, they relapse. And it's important to have a safe place, a trusted place. We used to meet in large groups, and now there's no community connection through concerts, through sports, through Little League, through anything. Why? We're trying not to get a disease that goes into the lungs, and when it fills your lungs, you suffocate. It's a very terrifying way to die because your brain is still working. You're aware, you just can't do anything about it. Oh, yeah. And then you add in one of the most violent, aggressive election cycles in modern times. And what do you have? People that are just completely at exhaustion level. The concept the world should be fair, well, it's been shattered. The need for a predictable world, a safe world. Nothing feels safe right now. Do you have belief in your government? Do you have trust in your leaders? Do you have belief in the media? Belief in science? What do you believe? Because when I think about belief, there was a research study done months ago that said there's a post-pandemic mental health wave surging. Well, I think it's here. When we look at the mental health multiplier impact of COVID-19, the first wave, the disease was spreading into a global level. That was in mid-March 2020. Remember, we were going to do 15 days to stop the spread, and everything was going to lock down. And there was anxiety and panic and hoarding supplies like toilet paper and Clorox wipes. April, May, part of June, lockdown, social isolation, depression. The research is showing us now, you may have seen in the New York Times over the weekend, that school districts are opening back up for students to go into classroom because there's so much isolation and a huge spike in adolescent suicide. You think, well, why? Maybe their family's falling apart. Maybe their parents have lost jobs. And at 14, you're old enough to understand, and some just feel overwhelmed and they give up on living. The fourth wave, the financial recession, unemployment, which started less than a year ago, was followed by the loss of normal. Mother's Day, Father's Day, Easter, Labor Day, 4th of July, Thanksgiving, Christmas, Hanukkah, New Year's Eve. Nope. When you look at the sixth wave, that's where we're at now. Complicated PTSD, complicated grief, suicide, domestic violence rates. You see, each of these things have built up until a level where people are completely overwhelmed, completely exhausted. Wave after wave after wave of cumulative stress has led to the inability to think clearly. Your prefrontal cortex does not work properly when you're completely exhausted. If you are out there fighting the waves, you can't think clearly. To feel so overwhelmed, and now somebody says, make a decision, you can't make a decision. You can't think clearly even when you see data. This is from Pew Research. About 60% of Americans say they would get the vaccine for coronavirus. What about the 40%? I mean, what's going on with them? About 37% of Americans have confidence to be able to say, I'll get the vaccine now. I feel safe with the researchers. I feel safe with the science. But when somebody says, I'm not getting the vaccine, remember, it's about belief. Your belief will shape your behavior. And the belief of a rush timeline, 37% say it's been too rushed. There hasn't been time for this vaccine to be properly vetted. 26% say they want to wait and confirm the vaccine is safe. 12% don't like vaccines at all. 10%, they want to wait and see how it works on other people. 15% say I'm not going to get the vaccination because of other variables that make it not safe. Now, safety is a big word. When we're talking to people about vaccine anxiety, focus on safety. When someone feels safe, everything else works. If they don't feel safe, everything else stops. Safety. So as we're moving forward, let's focus more about the perception, the emotion of safety and wellness. When a person feels like that doctor can be trusted, okay, what if I don't feel safe? Well, that doctor could be dangerous. My friend Henry Cloud says it this way. Think about a scenario. Somebody that you don't know puts on a mask, they take a knife, they cut you, they take all your money. Is it a good person or a bad person? It's a thought experiment. And you say, well, that's a bad person. No, because Henry says, what if the masked stranger is a surgeon? And what if they're cutting you with a scalpel to be able to cut out cancer, to cut out a tumor? And what if they're taking all your money because the billing office says this is going to be an expensive surgery? It's about a perception. It's about what you believe. So how can we help someone with COVID vaccine anxiety? How can I help them to be able to see, is this safe? Remember, safety is a perception. As we look at it, here's some of the big reasons why. The vaccine will give you COVID-19. Dr. Emily Landon said this belief stems from the fact that some vaccines, like measles, mumps, chicken pox, use live but weakened virus. The flu virus, by the way, works like that, to stimulate an immune response. The messenger RNA vaccines, that would be the COVID-19 vaccine, don't use the coronavirus live or dead. They're incapable of infecting someone with COVID-19. You cannot catch this because there is no COVID-19 in the vaccine, although that was one of the fears early on. What about making public health political? Governor Newsom in California said FDA approval of the vaccine is not enough. We insist on approval by experts in our state. Governor Newsom apparently believes that the doctors in California, maybe they're better than the doctors in Washington, D.C. Governor Cuomo in New York said, it would have been better if the vaccine release had been delayed until Joe Biden became president. And you say, what does the presidential status have to do with the vaccine? There are even some politicians like Congressman Ken Buck in Colorado. He said, I'm more concerned about the safety of the vaccine than I am of the side effects of the disease. You say, why would somebody say that? Let's go back to what they believe. What do you believe? Because there are a lot of conspiracy theories out there. Many believe that the photos of people getting the vaccine are staged because the photos posted on Facebook don't show needles piercing the skin, or they show the wrong syringe was used, or they show that the person administering the doses should have been wearing gloves. Now, the Centers for Disease Control does not have a standard about wearing gloves when you're giving a vaccine. But remember, a conspiracy is not based on facts. It's not based on anything except what somebody believes. So I'll ask it again. What do you believe? What do you believe? Do you believe Facebook? Do you believe the CDC? Do you believe the vaccine contains a microchip so the government can track you using 5G cell technology? What do you believe? Because if you believe that, and if you believe, wow, the government is tracking me right now, then you're not going to get the vaccine. Reuters News Service in London said the idea that the chip will allow the government and corporations to maintain surveillance of people who get the vaccine. He said, if we were, or the researcher said, if we were able to figure out how to inject microscopic technology into you, you'd have all kinds of rejection issues and responses. There's no known reason the government would need to develop a crazy technology to track you because you already have that technology in your hand already, your cell phone. And if you've seen the docudrama on Netflix, it's called The Social Dilemma. If you've seen it, then you already understand. If you haven't seen it, I would encourage you to check it out because what it shows is your phone, your smartphone, your Android or your Apple iPhone are already tracking you. There's already something there that says, hey, guess what? We know you're going to the grocery store. Google knows which one. So do you need a chip to do that? No, of course not, because it's not about a chip, but that's a common fear right now. Michael Porter Jr., who plays basketball for the NBA's Denver Nuggets, here's what he said, quoted on sportsyahoo.com. He said, personally, I think that the coronavirus is being used, obviously, for a bigger agenda. It's being used for population control. In just terms of being able to control the masses of people. Because of this virus, the whole world is being controlled, required to wear a mask, and who knows what will happen. You might have to have the vaccine in order to travel. That'd be crazy, he said. And when you look at that, you think, well, if you're going to parts of the world, don't you already have to get a vaccine? If you're going to a place that has malaria or yellow fever, that's right. But remember, the prefrontal cortex does not work when people are feeling completely overwhelmed. That's why one of the fears is the vaccination cards issued to those that take the vaccine, because it's a 2-dose vaccine. The Johnson & Johnson vaccine in clinical trials looks like it'll be approved in April. It's a single dose that can be stored in a refrigerator. The current doses that are available from Moderna and others has to be stored at incredibly cold temperatures. And sadly, many of those doses are thrown away because if they can't be kept at that temperature, there's only a very short period of time that can still be administered. But when we look at the idea, will those doses be used to track you, to keep you from going into a certain kind of business, riding on an airplane? If you don't have the vaccine, can you be blocked from going to foreign countries? Here's what the CDC says. Historically, some vaccination records have been used to determine if somebody can fly to certain countries. And if you've traveled internationally, many of you have, I have, and you have to be able to show that you've had certain vaccines, right? That's already there. Having a vaccination certificate, and by the way, there's an electronic one on every American. The state already has it. School children have it. When you get your pneumonia shot, it automatically uploads, so you don't get 10 next year. There's already a record. There's already a standard that says which vaccines have you received. Have you had your tetanus shot? That's written down somewhere. This isn't new, but fear doesn't operate that way because it's driven by a lot of other factors besides the facts. And then there's the anti-vax movement. Vaccines are toxic. Protect your children. Don't get them vaxxed, says Jenny McCarthy, who is the spokesperson. She is the face of the anti-vax movement. Her son has autism, and she believed a report, which has long since been discredited by a British doctor, Andrew Wakefield. His study was retracted, but she believes, and she's published several books, she's quite vocal about it. If you get these vaccinations for your children, you're going to guarantee that your children will have some type of disability. And she's not alone. Jim Carrey, who was her boyfriend for many years, said in this growing crisis, we cannot afford to blindly trumpet the agenda of the Centers for Disease Control, the American Academy of Pediatrics, or the vaccine makers. Now more than ever, we must resist the urge to close this book before it's been written. Lisa Bonet said vaccines could potentially introduce alien microorganisms into our children's blood. Rob Schneider, the actor, said doctors are not going to tell you both sides of the issue because they're told by the pharmaceutical industry, which makes billions of dollars, that it's completely safe. When you start to look at where people getting information, Lolita Wright was in the Black Panther films, and she said, I've always been a little skeptical of vaccines. And when she said that, the doom scrollers and the haters and the trolls on Twitter just blew up. And it looks like her career will be altered. She said, now they're making an example out of me for asking if something's right for my body. When you look at a vaccine, can somebody require you to take it? What if it's good for you? Well, if it's good for you to eat organic, to eat vegan, can we force people to do that? When you look at this huge amount of controversy, Alicia Silverstone wrote a book called The Kind Mama. She said there's not been a conclusive study of the negative effects of rigorous one-size-fits-all shoot them up vaccines. There's increasing evidence from doctors who've gotten distress phone calls from parents claiming their child was never the same. And I personally have friends whose babies were drastically affected this way. You say, wow, Dort, I had no idea there were so many celebrities, so many actors. But think about it. These people are afraid. I want you to understand there's two sides to every story. You may have heard, if you do marriage counseling, there's two sides, his side, her side, and then there's the right side. There's the truth. And where is it? It's usually somewhere in between. Do some people look at a situation and because they're trying to figure it out, look to Hollywood instead of look to the medical community? Of course. I mean, when you look at this, and by the way, it's not just actors. Robert Kennedy Jr., right, his dad, JFK, or his uncle. But when you look at, what's happened, Hank Aaron, you may have seen, died a few weeks ago and had just gotten the COVID-19 vaccine at the Morehouse School of Medicine. He tweeted, I was proud to get it. I hope you do the same. And then he's dead. You think, wow. And when you look at what happened, the Children's Health Defense Organization said home run king Hank Aaron died of an undisclosed cause 18 days after receiving the Moderna vaccine. The 86-year-old sports icon received the first of 2 doses in an attempt to inspire other Black Americans to step up to the plate and get the vaccine. And Robert Kennedy Jr. tweeted, Hank Aaron's tragic death is part of a wave of suspicious deaths among the elderly, closely following the administration of COVID vaccines. And when you look at this, you think, well, is there truth to that? Did Hank Aaron die because of the vaccine? That same weekend that Hank Aaron passed, talk show host and legend Larry King died of coronavirus. He was 87 years old. You think, well, is it the vaccine? What's killing people? Is this vaccine released from the Chinese to destroy the economy? Is it a secret plan to control the presidential election outcomes? Is it a tracking device from Bill Gates? Is it the beginning of an armed uprising to destroy America, to destroy freedom? Is the COVID-19 vaccine the mark of the beast? Or is it just another conspiracy? I grew up in Central Florida, and maybe like you, if you've grown up here, you've seen a lot of rockets go up from Kennedy Space Center. This year, 2021, when we're recording this, there will be over 1,000 satellites launched into space by NASA and SpaceX. And when you look at space rockets going up, is it real? Was the moon landing fake? There are people that believe that because they said, how did that shadow, when they're taking the pictures of the guys bouncing around on the moon? And how did every Apollo flight, how did the background look the same? Was it just a cut and paste in early Photoshop? There are people that believe it was filmed in a studio and it was filmed out in the deserts of Nevada. Was JFK killed by Lee Harvey Oswald from the 5th floor of the Texas Book Depository building in Dealey Plaza in downtown Dallas, Texas? Maybe you've been to Dealey Plaza. Maybe you've stayed at Reunion Hotel. That's the big ball that you see with the gold top on it and pictures of Dallas, or if you saw the TV show Dallas. Was President Kennedy killed by Lee Harvey Oswald or by the CIA? Standing behind that fence that you see on the grassy knoll in the photo on the left. Was he killed by the Cubans? Was he killed by the mafia? Was he killed by a group of Texas billionaires who didn't like his politics? You can go there today. And one of the things I've been interested in through the years, and I've spent a whole day in Dealey Plaza, is being able to try to figure out, what do these people believe? Do you believe that man landed on the moon? Or it was a trick? Do you believe JFK is still alive in a hotel in Dallas, Texas? There are people that believe that. What do you believe about Area 51? What do you believe about the Majestic 12? What do you believe about aliens? What do you believe happened in Roswell, New Mexico? You see, your belief will alter your behavior. If you say, well, Dwight, there's evidence. I want you to know there's always evidence of things. You may have seen the World Health Organization over the weekend released guidance to laboratories around the world to reduce the cycle count and PCR test so they could get a more accurate representation of COVID cases, because the current cycle, the World Health Organization said, well, it was too high, too many false positives. And you think, aha, is the government covering up? Or is it because this is a rapidly evolving and rapidly mutating situation, and we've never been here before? Does the government cover things up? Sure they do. Sure they do. Have you ever heard of the Manhattan Project? The secret group of scientists and researchers who worked on something called the atomic bomb to end World War II. Ever heard of Watergate? Ever heard of the Iran-Contra controversy and cover-up? Lieutenant Colonel Oliver North. Does government cover things up? Well, yeah. But one of the things, when you look at it, there's always somebody who can tell the story. When you have Bob Lazar, who said, I saw 42 scientists laser zapped at Area 51, and I saw it myself. I was a contractor. I had a degree from MIT. By the way, he's the one who started that rumor about Area 51. He still speaks. He lives here in Florida, and he still speaks at conferences, UFO conferences and such. But if you think about it, well, where are the obituaries for the 42 scientists who were zapped by laser beams from aliens? And then when he went further and they were questioning him about that, he said, well, the government had a secret program to take the smartest and the best and the brightest children who were orphans and to raise them up to be doctors and scientists so that when they were killed, nobody would know. And it got more and more far-fetched. With Watergate, the two reporters who broke the story for the Washington Post, they didn't have an inside track from President Nixon. They talked to secretaries. There's always somebody who can say, well, here's the whole story. And listen, until you know the backstory, you don't know the real story. So when we start to look at what's really going on with conspiracies, I mean, think about it. You know, we all believe, well, there's facts. Scientific research said COVID-19 is a real virus. It has natural origins. It started at the end of 2019. It's real. It's a fact. But look at myth. If you layer myth on top of fact, 5G mobile networks cause the spread of COVID-19. And a fallacy is to go down the road of two phenomena happening roughly at the same time and creating a causal link. For instance, Baby Yoda was released in 2019. The pandemic began in 2019. Therefore, Baby Yoda caused COVID-19. I know that's ridiculous. I like Baby Yoda. Maybe you do too. We like watching The Mandalorian. It was entertaining. But did Baby Yoda cause this? No, but that's how it works if your prefrontal cortex is not thinking. To get rid of conspiracy theories, to debunk it, you pay attention to investigation. You review, you analyze, and you use your sense of logic and reason. There's a wonderful little handbook. And if you have family that believe in conspiracies, I'd recommend it to you. It's called the Conspiracy Theory Handbook. Pretty good title. You can get it on Amazon. Another way to neutralize conspiracy theories is through logic-based inoculation. In other words, we're not going to inoculate for the virus until we inoculate for the conspiracy. This involves explaining the rhetorical techniques and telltale traits to be found in misinformation, so people can flag it before it has a chance to mislead them. There's 7 traits of conspiratorial thinking. When you spot those, you can see misinformation. You can see a baseless theory. If you've been told that 9/11 was an inside job, if you've been told, aha, the government had an inside track and this was done and it was a way to, no, you stop and you go, wait a minute. Are there contradictions to the theory? Is there overriding suspicion, like this secret group somewhere, the Majestic 12, the Illuminati? Is there nefarious intent? And when you look at it, something must be wrong. You'll hear the word should a lot. There'll be a lot of mystery. There's always a persecuted victim. There's always immunity to evidence of the contrary. And there's reinterpreting randomness, which will reinforce through the process of neuroplasticity, it will reinforce this sense of, aha, it must be true. So which is easier to believe? That Dr. Fauci and Bill Gates created a pandemic to try and control people because they want to make money on it? Is that why they're using vaccines, to insert trackable microchips into people? Or that the Bill and Melinda Gates Foundation committed $1.75 billion to the global response? What's easier to believe? Is it easier to believe that they want the first people to receive the dose, the very first people were healthcare workers? Is it easier to believe that they want to kill the healthcare workers, the doctors, that they want to kill the old people? Who gets it first? The elderly population. Actually, the doctors, nurses, frontline workers, first responders, they got it first. Do the Bill and Melinda Gates Foundation want to kill all the doctors and the firefighters? Do they not like cops? Are they just trying to make a buck? It comes back to, what do you believe? Because there are benefits to receiving a vaccine. The CDC says getting a COVID-19 vaccine can help protect you by creating an antibody response in your body without you having to become sick with COVID-19. Reading it right off the cdc.gov website. A COVID-19 vaccine may prevent you from getting COVID-19 or becoming seriously ill. And the research right now, we know you have a 95%, if you get both doses, you have a 95% chance of not dying from coronavirus. 95% chance? Wow. Oh, yeah. It may also protect the people around you from COVID-19, especially if they have compromised health systems. Now, if I told you you could buy a lottery ticket, and if you held your left foot up in the air, hopped around like a bunny rabbit, and repeated a chant, you'd have a 95% chance better of that Mega Millions giving you more money. I think you might hop around like a bunny rabbit. A 95% chance better of not dying from a disease? That's pretty good odds. So are you going to believe the scientist? You're going to believe social media? Because if you look at the scientific piece, the 9 largest US and European drug makers had a pledge This goes back to April 2020 to uphold the integrity of the scientific process in an attempt to ensure public confidence in the rigorous scientific and regulatory processes by which the COVID-19 vaccines are evaluated and approved. Said differently, they're sharing the science. Why? Well, it saves lives. But on social media, they just want to make money off of it. Or are they working 24-hour shifts to try to save other people's lives around the world? It's all about what you believe. Facebook announced last week in a press release, we will remove false claims that COVID-19 vaccines contain microchips or anything else that isn't on the official vaccine ingredient list. Facebook will remove conspiracy theories about COVID-19 vaccines that are known to be untrue, such as certain populations being tested on the treatment without their consent. Is the vaccine to get rid of all people from Asia, to get rid of all Republicans? You'll see there's a lot of fake news. There's a lot of misinformation. Because when you start to look at actual information from the World Health Organization, you'll see that Israel leads the world in vaccine and vaccinations, followed by the UAE, and everybody else is falling far, far behind, with India lagging. And you look at this, you think, well, why? Well, it goes back to what you believe. What do you believe? What do you about monsters? Now, if you've not seen the Disney Pixar film Monsters, Inc., I want you to know I'm going to spoil it, right? So close your 30 seconds because I don't want to spoil it because it's worth seeing. But if you have seen it, you know you don't have to be afraid of monsters under the bed. The little Miss Boo, that's Mike and Sully, by the way. The monsters didn't have power to scare you. That's up to you. It's all about what you believe. It's not because of medical science, it's because of neuroscience. It's because of psychophysics. Psychophysics is the process that describes the brain can become so overwhelmed with fear, it cannot process any more fear. Let me say that again. Your brain can become so overwhelmed with fear, your brain cannot process any more fear. What do you believe? Because your belief is shaped by stories and images and the perceptions of the group. Your belief is not shaped on data. If you just looked at data, by the way, if you just looked at data, you'll see that more Americans die from diabetes and heart disease every year than die from terrorism and serial killers. But you'll also find that more Americans live in fear of serial killers and terrorists than they do of eating a high sugar processed food diet. That research has plainly shown can lead to diabetes and heart disease. I want to be very transparent right now and tell you that I was one of those Americans. And I did a lot of worked for the government, worked for the military, was doing a lot of things, working with the Department of Defense to go to Iraq, work with troops during the war in 2006. Because I believed, well, this is what we have to spend our time and energy on. And I paid no attention to health. Yep, I was one of those people that had a heart attack. Thank God for the Orange County Fire Rescue. That's why I love the work that Central Florida Behavioral does to be able to help first responders because they came and got me. I had a heart attack at SeaWorld on a field trip with my son. Getting ready to go work with troops, I said, well, I'm going to be gone for 6 weeks. Let me go spend a day with a bunch of 12-year-olds. I'll be a room dad. And having a heart attack at a theme park, they got to me quickly. They stabilized quickly. They got me to Dr. Phillips Hospital and then downtown to Orlando Health to be able to have heart surgery to clear 4 blockages, one in the left lower descending artery at 99%. I got a second chance. And you know what I believe now about a diet and lifestyle that leads to heart disease and diabetes? Because I've been told I was pre-diabetic for years. Yeah, fine, thanks. You know, pass the pizza and donuts. I'll be fine. Nobody in my family's ever had a heart attack. Belief is shaped by stories. I hope that my painful story, it changed everything. I got a second chance, but I can never ride on roller coasters with my kids. Got a second chance to live and enjoy life and go to high school graduations and dance at a wedding with my daughter. Got a second chance to live. It was altered because I didn't believe. What do you believe? Because if you're into psychophysics, you understand that your brain can get so numb you can't make clear decisions. But stories and images and perceptions, not data. If you looked at data, about 20 people a year are killed by sharks. But millions of people are terrified of sharks because of Jaws. Why? Because your amygdala fires up and your limbic system fires up and it magnifies emotions. If I can make you afraid of Freddy Krueger on Elm Street, if I can make you afraid, all of a sudden facts don't matter. You see, we have to measure actual reality if you want to measure risk, not perceived reality. Perceived reality is, aha, that person has a chainsaw, therefore that person is coming to cut me into pieces. No, that person's probably a tree trimmer. When I look at actual reality, are you afraid of death? Are you afraid of a loss of control? This vaccine will protect you at a 95% efficiency level where you won't die from something. And what you'll find is that for a lot of people, they're more afraid of losing control because they feel out of control. Because the more anxiety you feel, the less control you feel, the more you have a need to believe a rumor because you just want to feel in control of something. It's the choice. It's a choice to be able to feel in control instead of the choice to prevent a disease. Perception of risk, that's what shapes things. So who do you believe? Do you believe Arnold Schwarzenegger, who said, "Today was a good day. I've never been happier to wait in a line. If you're eligible, join me and sign up to get your vaccine. Come with me if you want to live," the Terminator said. Joel Gray said, "What's been helping me is a solid belief there is an end. I want to live. I love life." Sam Jackson, wearing an Avengers mask, said, "I'm at the forum getting that first jab. It's vaccine spring. Go get yours. I got mine." Dr. Daniel Amen with his wife, Tana Amen, said, "I'm at Disneyland getting the COVID-19 vaccine. As a healthcare company, we feel responsible for protecting the health of our patients." Do you believe Al Roker from the Today Show? He joked, "Will I get a Hello Kitty Band-Aid?" That's what he said after he got his vaccine. Do you believe President Biden? When he got his vaccine, he said, "I'm doing this to demonstrate that people should be prepared to take the vaccine. There's nothing to worry about. I'm looking forward to the second shot." The scientists and the people who put this together, the frontline workers, the people who are the ones who actually did the clinical work, they're just amazing. We owe you big. We really do. What do you believe? Because how do I get a scared person to give up on their fears? Well, you're not going to stop and tell them that they're crazy. You're going to do what Larry King said. When they asked him what was his secret to interviews, he said, "Listen." Most people never feel listened to. They never feel heard. So listen to people. Don't call them crazy. When somebody believes the fear, they're trying to provide order to their world. One of the research studies showed that if you showed squiggly lines to most people, if their lives were stable in all 5 of the core variables, they looked at it and said, "Those are squiggly lines. There's nothing there." But if somebody's world was out of balance in the 5 core areas, physical, emotional, spiritual, relational, and behavioral, well, if their life was out of control, they would see images that were not there. They were trying to provide control because their life was out of control. Sometimes people will get involved, particularly on social media. They're lonely. And to be able to be part of something, to be part of something huge. Did you hear the conspiracy? If you eat chocolate Hershey bars from Godiva because they filed for bankruptcy, it might give you a disease, right? When people talk about rumors, they're trying to connect to something. And understand right now, we saw it in a training event hosted by Central Florida Behavioral. And it was about loneliness and desperation, the isolation and desperation people are feeling. And if you don't understand, loneliness is one of the core factors leading to mental disorders. Go to the Central Florida Behavioral website, check out the link to deal with the mental health elements of loneliness. Because when people feel so lonely, they want to be part of something. They want to connect. They want community. They long for that. So we're going to start by validating. I can tell this is important to you. Maybe you have clients that are afraid of a vaccine, afraid of doing what's healthy. All right. I can tell this is important. You're listening. Don't call them crazy. If you have family members and you say you're acting crazy, you do not change an irrational person by calling them crazy. That does not work. Think of a bell curve because there are early adapters to change. They've already changed. But in the bell curve, the group in the middle, they need a little time. They need stories. They need a little time because to connect them, people that they believe in, people that they know that have had the vaccine, they need to feel that sense of connection. It's a gradual process. So you stop and say, help me understand. Now, that's my favorite question in dealing with complicated situations. Help me understand. Help me understand, why are you drawn? Because you want to ask questions so they drop their guard and you can then start to plant some seeds of doubt to help them in a rational way. If it's really true, let's look at both sides. Did Hank Aaron die from this? Or did Hank Aaron die from other health issues related to a man that was 86 years old? By the way, the Centers for Disease Control, cdc.gov, please go there, will tell you that the average man in the United States will not see his 79th birthday. So when you start to look at opening up a conversation, let's research both sides, because they'll say, I've done the research. Well, let's research both sides, because a conspiracy theory is increasingly complicated. It's increasingly far-fetched. Instead of I'll do research to defend my theory, let's do research to challenge it. In a debate, you do both sides. You plant the seeds of doubt about how this could be wrong. You go to trusted sources like the CDC, and you say, well, you know what? Let's look at the science. And here's one of the key takeaways. By the way, you'll receive this from Gavi. He'll send it to you as a follow-up, because it looks at mentally resilient people. If you're above the line that says average, functioning at 50%, you're able to think clearly. Your prefrontal cortex will work nicely if you're above that average level. It's a scale I developed that goes from 0%, where people are at self-harm, suicidal, homicidal. When people get to around 25% using this scale, where they feel shattered, self-destructive, addictions are taking over their life, they're feeling completely overwhelmed, that's when you make the call to Central Florida Behavioral, 24 hours a day, because they need more help. They need science and neuroscience. They need medical science. There's a proven behavioral, psychological, medical way for people, humans, to get better. But if they're below that line, they'll believe just about anything to find relief. Think about it. Who wakes up and says, I'm having a bad day at work. My marriage is really in trouble. I'm fighting with my partner. You know what I think I'll do? I think I'm going to go really get drunk and get a DUI. That's going to make it better. No, alcohol does not make a complicated situation better. And you think, well, why do people do that? Why do they still get DUIs? Why do they still run through traffic lights and kill people? Why do they do that? Well, stop asking why and focus on what we can do. The why is because they're not thinking. Why would somebody say that on social media? They're not thinking. The lower you go below that average line, the less your prefrontal cortex is working, the less executive functioning is working, and the more likely that someone will make an impulsive, exhausted decision. Exhausted people do exhausted things. And it's your job and it's my job. Let's help them. And how do we help them? Let's create some stability. Let's create some daily patterns, and let's create support to be able to say, you're not in this alone. That's what Cotton Mather did. He was a minister, and you say, where have I heard that name? Oh, Cotton Mather was a minister as a young man who was involved in something called the Salem witch trials. In the late 1600s, he was part of saying, these young women, and it was suspicion, and it was rumor, and it ruined his career. After that was over, he said, I want to be a man of science. And he went and achieved a fellowship in the scientific community in London, England. And he started doing research in the early 1700s, because in 1702, there was a smallpox outbreak in Boston, Massachusetts. Over 4,000 people died. In 1721, 8,000 people died. But between 1702 and 1721, he met a young doctor, Dr. Boylton, who wrote a little pamphlet, an account of the smallpox inoculated in New England. By the way, you can read about this because I love to read. I love story. Until you know the backstory, you don't know the real story. There's a book called The Fever of 1721 by Stephen Cost, and it'll tell you this in great detail. It's absolutely fascinating because Cotton Mather was trying to redeem his career, and he was telling everybody, you can inoculate against smallpox. In 1721, he was a spokesperson, and Dr. Boylston would inoculate as many people as he could find. But he horrified people in Boston in 1721 because the average medical doctor and the average business person said inoculation came out of West Africa and it can't be better than the medicine we have. And they didn't believe. So Dr. Boylston inoculated his 6-year-old son, Thomas, and did it publicly. And people were horrified. And his son got sick and then got better and then was protected from smallpox that killed people. Oh, look at the numbers in the chart. Again, from the research, The Fever of 1721. Because after 1721, by 1730, look how the numbers dropped. A spike again, 1752. By then, both of these men were gone. But the science lived on. And it went down and down and down. And to be able to, not just through word of mouth, but all doctors practice the smallpox vaccine in Boston, it dropped statistically to nothing. By 1811, 2 people died. When you start to look at, well, Dwight, what's the point? Through the faith community, through the science community, through your community, let's talk about what you believe. Let's talk about what you believe. Because belief changes behavior, not science. It's what you believe about the science. What do you believe? What do you believe about helping people have a 95% chance better of not dying from a disease? Belief changes behavior. And I'm glad that we could spend some time together today to start a conversation. Now, if you have questions, you can type them into the chat box. Gavi will ask me the questions. And if you want to stay connected, because this is an ongoing, evolving crisis, we're going to be creating some incredible resources for you in the month of March when we get to the 1-year anniversary of the COVID pandemic. And Central Florida Behavioral has led this region in creating tools and resources and training. I look at the work that Vicki Lewis and Gavi Berman and the team have been doing, because Gavi and others know this is going to go on maybe for another year. And this team of people in Central Florida have said, let's come together and start conversations so we get through it better together. Gavi, do we have any questions?
Dwight, we do not have any questions, but I just want to echo what you said and say, we over here, you said, what do you believe? And Central Florida, we believe in science as well. And I think that's why people trust us as the experts here in Central Florida, and we're happy to service the community in that type of way. So thank you, Dwight, so much. Thank you so much for this message of resilience. We agree very much that this is going to go on for a while. This is not over at all. And thank you so much for the trainings, for supporting us and helping us to support the community in our efforts to provide mental health services to the community.
Well, we're in this together. I look forward to joining everyone in March to show how that if you can change and make little kids feel safe instead of the combative environment that we see. Because right now, Gavi, we're set up to have continued decades of this group does not trust that group. And where did they learn it? They learned it by listening to their parents and the teachers and the adults around them. And if we want any hope of a connected community, a diverse community, a growing and vibrant community, it starts with the children, and many of them are terrified right now. So I'm very excited about our time together in March.
Absolutely. Dwight, there is one question that's coming from Pauline Gray, actually. Let's go ahead and see if we can answer that one. The question is, if you have COVID, can you get the vaccine at that time, and will it be effective?
That's more of a medical question. And let me say, if you have it, I don't think you're able to get the vaccine, but I'm not certain. I do know there's a fantastic page at cdc.gov that'll ask your FAQs. I know that my friends who have had it were not in the age group that were allowed to get the vaccine. So it's very possible that you can, but check cdc.gov, check the local government. And let me say, I should have said this earlier. I'm in an age group that can't receive the vaccine yet, but I want you to know, my wife and I both, once it is available for our age bracket, then we'll be in line next to you. Why? Because we believe that vaccines are an opportunity to be able to prevent dying from a terrible disease. And there's the button I wanted. We'll be in line, and I hope that I'll be in line next to you. Dwight and Sheila believe that vaccines are part of science. We do not believe that it's a microchip to control us, not even 1%. And we believe that Mike Wadowski and Sully were the good guys. And we believe that always there are no monsters under your bed, and always we get through it better together. So check that website and check the science piece, the medical part.
Awesome. Thank you, Dwight. And thank you everybody so much for joining us today. Again, I sent the link to the survey. It'll also be sent as a follow-up in the email I sent, as well as the survey, I guess, Dwight, that you were gonna give me to send out.
I'm gonna send you a one sheet that shows the levels of thinking. If somebody's above this line, they can have executive functioning, they can have that prefrontal cortex, and they can make good decisions. But if they're below the line, and that's that stressed, anxiety, fearful, overwhelmed, that's the group that's the most likely, because they're just so overwhelmed, to believe anything, because they're trying to find relief in the middle of the storm. And it's not a sign of weakness, it's a sign of human. And so just to be able to see if you're working with clients or you're working with your own family, are they at that stage where they're feeling pretty comfortable and they can make a good, clear decision, or are they overwhelmed? And if they're overwhelmed, Gabi, we're not going to try to lead them toward making a decision because they're overwhelmed. We're going to help stabilize the overwhelmed piece, because if they're thinking clearly, once they can think clearly, they won't need me to be able to go, well, this is a good idea. They'll already have made that decision themselves.
Right. And then one other question from Nicole.
Sure.
Her question was, I guess you had named a book on conspiracy theories?
Yes, it's called the Conspiracy Theory Handbook. And it's a little short book, but it's just incredibly fascinating because there are so many conspiracy theories. And some of us really have people that believe in the Illuminati. They look at things and they'll go, aha, there's this secret society, and they're trying to take over and corner the market of who gets the best deals at Joann's Fabrics or whatever. And you'll go, well, conspiracies are wacky. Not to the community of people who many times feel lost, lonely, isolated. They're looking for a place to connect. And sometimes if they can find a connection point through a political idea, a religious idea, if they can find a connection point through some obscure rumor, and they're the only ones who know, sometimes they'll become like an evangelist. They will do everything possible to try to convince the people around them. There's a conspiracy about craft supplies, and I need to let you know. And don't get mad at them. They're trying to, based on what they know, what they believe, they're trying to save your life. They're trying to protect you from something. That's why if you call them crazy, you actually drive them further into that subgroup. There's a website called Reddit. Don't go there. There are things called subreddits. Don't ever go there. I know some people are going, what is it? I want to go there. There are places on the dark web. Google is something called the web. There's something called the dark web, and it's very dark. And that's where the conspiracy theorists go. And some of them are quite dangerous. If you want to buy a machine gun or a tank, there are places in subreddits, but these are very evil, dark criminal activities. But they exploit people who feel lonely or isolated, who gets drawn into a cult, people that believe in certain conspiracies. But if you go deeper, Gabi, you'll find it's people who've been wounded, people that are lonely, people that have had some type of wounding. And that's what Central Florida Behavioral, that's what the mental health community is about. We go to that wounded spot because when you can see that wound heal and recover, mental wellness instead of mental illness, that person is not drawn into a cult. That person is not drawn into a subgroup, because that person's at a place of wellness and health. And that's what we want for everybody. That's why we do these trainings. That's why I'm glad everybody joined us today. Until next time.
Dwight, thank you. And thank you everybody for joining. Well, we will see you again soon. And until then, have a fantastic weekend and a great rest of your January. We'll see you in February on the 15th for our next CEU event. Take care.